Okay, good afternoon all. Today we are going to see about the post-operative care during gynecological, and it is commonly used post-operative care, that is uh, for all the surgeries. So we can say that for especially for the gynecology, we can see individually. After that, what will be the um, condition, according to that we can give. So the common post-operative care here we have discussed, we are going to discuss. The aim of post-operative care is to provide the patient with a quick, painless and safe recovery from the surgery as possible. Then there are many phases, mainly two phases we are saying, that is immediate, then intermediate and convalescent. Immediate means post anesthetic, that is the phase 1. Immediately on a sudden we are giving the care, that is the immediate phase. Then intermediate, convalescent. You can see the immediate phase, it is the immediate recovery phase, requires intensive nursing care to detect early signs of complication. For example, if the cesarean section has done, then we should be 24 hours, we are nil per orally we are saying, and we should be assessing the vital signs, and if there is any change in the vital signs, we are seeing for going for the further treatment. Likewise, for his hysterectomy, then what about the bleeding, that all things we should be assessed. Then receive a complete patient record from the operating room, which to plan post-operative care. It is designated for care of surgical patient immediately after surgery and the patient requiring close monitoring. Okay, so that we are shifting the patient to the after the hysterectomy or post-operative surgery, that is the cesarean section also, we are not shifting the patient to the ward or room. We are observing the patient immediately, we are observing the patient continuous with continuous monitoring, that is immediate ICU that we are shifting. Okay. Then phase 2, care of the surgical patient who has been transferred from the phase 1 post-operative unit. As they from the immediate post, we are transferring to the room, then also we are care is continuing and also checking the vital signs. Patient requiring less observation and less nursing care than phase 1. This phase is also known as step down or progressive care unit. The patient has progressed. Then nursing management, a post-operative unit, to provide care until the patient has recovered from the effect of anesthesia. And assess the patient vitals, pulse, volume, regularity and depth of the nature of respiration. Then assessment of patient's oxygen saturation, skin color. Then protect airway by proper positioning of patient's head, by clearing airway, oxygen therapy. Then pharyngeal obstruction can occur when the patient lies on the back, as there are chance for tongue to fall back. Then maintaining IV stability. Hypovolemic shock can be avoided by timely administration of IV fluids, blood and blood products and medications. That is the hypovolemic. We should be maintain the input-output chart. Then replacement of fluids, colloids or crystalloids. Keep the patient warm. Then monitor intake and output charter. Then monitor the vitals continuously with the patient condition. Then if the patient shock is present, then we should maintain the position. Keep the patient in shock position, flat on the back, legs elevated at 20 degree knee chest, that is kneecap position, straight. Then assessment of surgical site. Hemorrhage. It is a serious complication of the surgery that result in death. Then it can occur in immediate postoperatively or up to several days after surgery. If left untreated, cardiac output decreases and blood pressure and HB level will fall rapidly. Then for relieving pain, if the patient is having more pain, for administer opioid analgesic as per doctor's order, epidural analgesia, NSAIDs, psychological support to relieve fear to give support. Then controlling nausea and vomiting. These are common problem in postoperative period. Medication can be administered as per doctor's order. Example, we can metoclopramide injection ondansetron. Then discharge from the postoperative unit. A patient remains in the postoperative unit until the patient has fully recovered from anesthesia. Following measures are also should be determine the patient ready for discharge from postoperative unit. Stable vital signs, orientation to person, place, time or events, adequate oxygen saturation level, urine output at least 30 ml per hour, minimal pain, adequate respiratory function, Alrate score. Alrate score means that is not much important in this gynecological. So that is the pain assessment and that is how the patient has stable. That is the score. That postoperative anesthesia care unit. Then teaching patient self-care. That is after discharge or from further days of the postoperative period. That all things we should be teach them. Expected outcomes, immediate postoperative changes, written instructions like wound care, activity and dietary recommendations, medications and follow-up. Okay, thank you.